Welcome to this MedNexus Explainer. Today, we're zeroing in on something that, frankly, demands our absolute focus and deepest compassion: stroke. It's one of the leading causes of disability and death worldwide. But here's the powerful, hopeful truth we need to anchor to right off the bat. We can save patients and we can preserve brain function if we know exactly how to react. So, let's dive right in and demystify this critical medical event together.
Picture this for a second. One moment, someone is just talking normally, going about their day, maybe just having a cup of coffee. And the next? Without any warning whatsoever, everything completely changes. Maybe their face suddenly droops, their words become all jumbled and slurred, or an arm just inexplicably goes weak. It's terrifying, right? This is the sudden ambush of a stroke. And in that exact, precise moment, millions of vital brain cells are suddenly at immediate risk of suffocating.
Okay, let's dive into this. Here is our roadmap for today. First, understanding what a stroke actually is. Then, recognizing the warning signs. After that, we'll cover emergency response and treatment, followed by rehabilitation and family support. And finally, we'll wrap up with prevention and key takeaways.
All right, part 1, understanding a stroke and its mechanics.
Fundamentally, a stroke is like a sudden plumbing problem in the most complex organ in the universe. Think about it. Our brains consume 20% of our body's entire oxygen supply. So when the blood flow to a specific part of the brain just suddenly stops or drops, those oxygen-starved cells simply can't survive. They literally begin dying within minutes. And because the brain is the ultimate control center for everything we do, the physical symptoms you see depend entirely on which specific neighborhood of the brain is being starved.
Now, what's really interesting about this slide is how this plumbing failure actually happens. Generally, it's one of two ways. Ischemic stroke is by far the most common. We're talking about 85% of all cases here. It's caused by a physical blockage. Imagine a blood clot acting like a cork jammed in a pipe, often because of things like atherosclerosis or high blood pressure. On the flip side, we have the hemorrhagic stroke. This is when a blood vessel actually bursts and bleeds directly into the brain tissue. So two very different mechanics, but they both lead to that same catastrophic oxygen starvation.
There's also a third term you really need to know: TIA, or transient ischemic attack. You've probably heard people casually call this a mini-stroke. Basically, the blockage is temporary, and the symptoms might actually just vanish entirely on their own, usually within 24 hours. But listen to me carefully on this one. Even if the symptoms disappear, a TIA is a massive, flashing red flag. It is your body's ultimate warning sign that a full-blown, devastating stroke could be right around the corner. It absolutely must never, ever be brushed off.
Moving right along to part 2, recognizing the warning signs and spotting a stroke.
Listen, if you only take one single thing away from this entire explainer today, let it be this: the absolute easiest, most effective way to remember stroke symptoms is the acronym FAST. F is for face drooping. Ask the person to smile. Does one side of their face look weak or uneven? A is for arm weakness. Have them raise both arms. Does one arm just involuntarily drift downward? S is for speech difficulty. Ask them to repeat a simple sentence. Are the words slurred or just hard to make out? And finally, T. T stands for time. If you see literally any of these signs, it is time to call emergency services immediately. FAST. It's simple, it's sticky, and I promise you, it saves lives.
Now, while FAST covers the heavy hitters, the brain is incredibly complex. So there are other neurological symptoms you should keep on your radar. Things like a sudden loss of vision in one or both eyes, an incredibly severe headache that comes out of nowhere, sudden dizziness, intense confusion, difficulty swallowing, or sudden numbness, especially if it's just on one side of the body. You notice a pattern here? The key word is sudden. If it hits like a flip of a switch, you are dealing with a medical emergency.
Which brings us to part 3, emergency response and treatment, where every single minute matters.
In the medical world, stroke care professionals live by a chilling but incredibly accurate mantra: time is brain. Let me put that into perspective for a second. An estimated 1.9 million neurons die every single minute a stroke goes untreated. That's a staggering number. Time is the ultimate antagonist here. You can't negotiate with it, you can only beat it by moving with absolute urgency. And that urgency is tied to a very specific, critical window: 4.5 hours. See, for patients having an ischemic stroke, that's the one caused by a clot, remember? Doctors can often use highly effective clot-dissolving drugs to break up the blockage and get the blood flowing again. But this treatment is incredibly time-sensitive. It typically has to be given within exactly 4.5 hours from the moment those symptoms first started. Once that golden window closes, the treatment options drastically change and the risk of permanent disability shoots right up.
Because that clock is ticking so fast, what you do at home is absolutely vital. First off, call emergency services instantly. Don't try to drive them to the hospital yourself, okay? An ambulance can actually start life-saving protocols while en route. Second, look at the clock and write down the exact time the symptoms started. The ER docs will desperately need that for their 4.5-hour window. Keep the person resting safely, and this is crucial. Do not give them any food, water, or medication. If the stroke messed with their ability to swallow, they could literally choke. And finally, no home remedies. Waiting around to see if they just sleep it off or get better is literally the most dangerous thing you can do.
And this brilliantly illustrates what happens the second a patient hits the ER doors. Rapid evaluation kicks in immediately, and the very first step is almost always a CT scan. This scan is the ultimate fork in the road. It instantly tells doctors, are we dealing with a clot or are we dealing with a bleed? You absolutely cannot treat a bleeding stroke with clot-busting drugs. That would be catastrophic. So once that CT scan dictates the path, treatments can range anywhere from mechanical thrombectomy to physically remove clots, all the way to intensive care and surgery for a bleed. All right, let's shift gears to part 4, rehabilitation and family support, the long-term path to recovery.
Now, recovery from a stroke can vary widely. Some folks recover really well, while others face long-term hurdles like weakness or memory and speech issues. But I want to give you a profound scientific reason for hope, and it's a beautiful concept called neuroplasticity. This is the brain's almost miraculous ability to reorganize itself. When one area of the brain gets damaged, a dedicated rehab team, we're talking neurologists, physiotherapists, speech therapists, they can literally help the brain form brand new neural pathways to bypass the damage. Essentially, the brain learns how to wire around the roadblock.
But the medical team is only half of the equation here. Family support is the absolute cornerstone of a successful recovery. The emotional toll of surviving a stroke is just immense. Survivors frequently battle things like severe anxiety, depression, fear, sometimes even profound personality changes. So families act as the ultimate safety net. You do this by constantly encouraging them to do their rehab exercises, making sure medications are taken perfectly, modifying the house to prevent falls, and honestly just providing deep patient emotional support. It's a long road, and keeping frustration and blame out of the picture is so essential for everyone's mental health.
Finally, we reach part 5, prevention and key takeaways, how to protect your brain.
You know what the most incredible fact about stroke is? A massive number of them are entirely preventable. They don't just strike out of nowhere. They often build up over years through risk factors that we can actually manage. If you want to protect your brain, you have got to manage your blood pressure. Hypertension is a huge villain here. You also need to manage things like diabetes, strictly avoid smoking, address high cholesterol, and monitor your heart for your regular rhythms like atrial fibrillation. And of course, fight back against a sedentary lifestyle with regular exercise and a healthy diet. You really do have the power to control these variables.
So the crucial point is making sure we lock in these absolute must-remember medical takeaways before we wrap up. Number 1, ischemic strokes are the most common. 2, FAST is your essential tool for recognition. 3, an immediate hospital CT scan differentiates the stroke type and dictates the treatment. 4, uncontrolled hypertension is your biggest manageable enemy. 5, a TIA is a blaring alarm system you cannot ignore. And finally, early, dedicated rehab dramatically improves outcomes. A stroke can alter a life in a matter of minutes, but recognizing the symptoms early, moving with absolute urgency, and knowing how to prevent them, that can protect the brain and dramatically change the course of recovery. Awareness truly saves lives. So, I'll leave you with this final thought. What changes will you make right now to protect your brain health, and who will you share this vital fast awareness with tomorrow? Thank you for learning with us here on this MedNexus Explainer. Stay safe and stay informed.